When we start the journey of cancer treatment, I do establish a relationship with the patient so that they are able to rely on my expertise in order to guide them through the different processes. Even after they are referred to other specialists, I continue to follow them to make sure there isn't any kind of urologic issues. Having a relationship with the patient is very important because I think that really establishes the trust that the patient have in me. And I hope that they are able to trust me with their well-being. Compared to 10 or 20 years ago, we have a lot more techniques and equipments that are available that weren't available at that time. And with these equipments, that opens up a broad horizon of how to get the same cancer control without having to produce a significant amount of trauma to the patient. In urologic surgeries, a lot of the advancements has been in robotic instruments and robotic surgery. It doesn't mean that a robot is doing your surgery. The surgeon still does it. It's just that the instruments that we use minimized so that you can have a few small incisions about maybe half an inch across rather than a significantly long incision about this across your abdomen. Significant benefit is part of the healing process in that there should be a lot less pain associated with the surgery because of the small incision. There is a lot less manipulation of tissue that's required for open operation that we do not necessarily need to do during robotic surgeries. Certainly, preventative medicine is key. The earlier we detect cancer, the more options we have in order to treat it, and the options are oftentimes less invasive. For example, I have a patient who I have treated them for a kidney stone, where then later on we discovered that they have prostate cancer, and we discussed the options, and we ended up having a prostatectomy to treat the cancer as well. I think it's very rewarding to be able to help the patient with not just one, but multiple medical issues within the urology field so that they can stick with one physician that they're familiar with rather than having to go to multiple different urologists. Oncology is a big part of urology. Certain cancers that we treat as urologists, such as prostate cancer, are pretty common, and it's a big part of any urologist's practices. It is very exciting to see a patient back after surgery and be able to look at their follow-up imaging studies and see that there is no cancer, and all we need to do is to monitor and observe. That is very exciting for me and also for the patient. And that is a big part of why I love the job I do. As a urologist, we are able to help a lot of patients with cancer of the urologic system, and it's often very exciting to be able to see those patients back after they're cancer-free.